What's up, nurslings? Dr. Squeech here, and today we are going to be talking about one of many classes of antihypertensives, the ACE inhibitors. Now, what I want you to remember about hypertension is that a lot of these antihypertensives are going to lower the blood pressure by causing vasodilation or making that blood vessel bigger. An example I use in class all the time, think of your perfect milkshake. I hand you your perfect milkshake, you're ready to drink it, and I give you a coffee stirrer to drink it out of. Think about how much pressure you're going to have to put on yourself to get that milkshake up through that coffee stirrer. Why? Because the lumen or opening in that vessel is very, very small. Versus I hand you the milkshake and I hand you a nice big milkshake straw. Bigger space, bigger vessel, bigger lumen, less pressure, and everything is easier. The blood vessels are the same way. So in a hypertensive state, the blood vessels are really tight. So what we want to do is loosen them up a little bit, make the space on the inside a little bit bigger so that the heart and body are under less pressure to get the blood where it needs to go. So we are going to be using the canals mnemonic like we talked about before, and I have gone ahead and written the pertinent information, and we're just going to talk about it. So first is the C, classification. So I went ahead and wrote ACE inhibitors. However, if you're studying things that have things in common or a grouping of medications, it's a lot easier, especially when you're using your canals, to study them as a class. Case in point with ACE inhibitors, I went ahead and put in parentheses PRIL. And I know I have a glare on my whiteboard, I apologize. In ACE inhibitors, they all end in PRIL. So it's a nice pharmacological gift that we get. If it ends in PRIL, odds are it is an ACE inhibitor. You can go ahead and write some examples out if you want, but if you write a little reminder or a cue or something like that to kind of trigger your brain to think, oh yeah, they all end in PRIL, it does help with remembering your information. Now, the ACE stands for angiotensin converting enzyme. Now, in pharmacology, odds are when we talk about enzymes, we don't like them. They do something in the body that we're not fans of. In this instance, the angiotensin 1 in the body has an enzyme that goes with it that converts angiotensin 1 to angiotensin 2. And angiotensin 2 is a potent vasoconstrictor. And vasoconstriction with a hypertensive patient is the last thing that we need. Why? Because with vasoconstriction, the vessels get tighter and the pressure goes up. So what we do is we inhibit the enzyme that turns angiotensin 1 into angiotensin 2. No angiotensin 2, no vasoconstriction, and the pressure does not increase. So when we look at the action, yes, it decreases blood pressure, but like we said before, you have to know how it does that. So I can't just say, well, it's an antihypertensive. Well, how does it work? So it actually inhibits the ACE enzyme. And in doing so, causes that vasodilation. That is what actually lowers the blood pressure. Think what's happening in the cells in the body, what's going on in the tissues. Nutrition-wise, there's a relationship between ACE inhibitors and aldosterone. And the relationship between those two actually makes it more difficult for the kidneys to excrete excess potassium. So potassium ends up backing up into the body, increasing our levels. And we can have some pretty dangerous things happen in the body when you have too much or too little potassium. In this case, we have too much. So I would tell my patients not to avoid potassium altogether, but be very careful with potassium-rich foods. Here you can make a list of potassium-rich foods. Maybe we're looking at a nutrition question on NCLEX. Maybe we're looking at, a teaching question. So you can make a small list of potassium-rich foods to kind of talk to your patient about, just to kind of help you. With administration or antidote, administration-wise, if you know something is going to impact a vital sign, check that vital sign. If you know something is going to lower the blood pressure, the first thing you need to do is check that patient's blood pressure, because we never want to give a patient a medication that's going to harm them while trying to help them. Labs, of course, we already talked about the potassium level potentially being increased, so I have to keep an eye on that. Depending on your lab resource, 3.5 to 5, 3.5 to 5.3 is considered your normal range, but realize that different labs are going to have different ranges. So whatever your instructors tell you about what they're using as a normal range for testing, please pay attention to that. With our side effects, we could have tons and tons of side effects. But like we said before with the canals introduction video, is that I'm after the big ones. I'm after the ones that are characteristic, maybe even unique. So here, it's noteworthy to say that the potassium level could increase because it's part of how that medication works in the body. It's a priority for me to assess that. So I would definitely write down increased potassium level. Low blood pressure, it's what the medication's supposed to do. But as a side effect, you can have things work a little too well. So low blood pressure can be a side effect of this medication. Another notable one here is a dry hacking cough. This is very characteristic of ACE inhibitors. And in fact, it's sometimes a reason why physicians or other providers will take patients off of an ACE and put them on something else because of the complaints of this dry hacking cough. I hope this helps you. We're going to be working a lot with the canals with different pharm, moving through cardiovascular. We're going to hit respiratory and all kinds of things. Let me know if you have any questions or suggestions in the comments. Thanks, guys.